Our Cabinet Secretary for the Ministry of Health, Madam Nakumicha Susan Ufula, Her Excellency, the Governor of Meru County, Madam Kawera Mwangaza, our PS, Harry Kimtai, all the dignitaries that have been mentioned today, allow me to write on the protocol. Wananchi wa Meru mugeni. Mugeni kaere. Asanti sana. Waziri, utaniruhusu sana tuende kidogo kwa hii program. Vile tumesikia tunaenda live in a short time. But allow me to take this opportunity to thank everyone who is here today and say that we have done a good job together. And this is not the end. We are still working together to ensure that we end AIDS by 2027. Your Excellency, the Governor, we really appreciate you hosting us because you have seen what great leadership of women can do. And we know with our Waziri here, even the challenges of triple threat in Meru County, zitaisha. With those few remarks, allow me to just request my colleagues, the CEOs who have accompanied me, to just stand up and wave. CEOs who have accompanied me. We have KMTC. We also have the rest outside there. I've seen Kenyatta, Kamuri, and all of them. We appreciate you. Let me call our chair to also appreciate the other chair persons present today. And from there, we shall progress with a very, very short program that anybody who comes on stage can only take not more than 5 minutes, because then we'll be going live and Waziri will be taking over the program with the Madam Excellency, the Governor. Asanteni sana.
Thank you very much, Madam CEO. Our distinguished guests, Madam CS, Susan Nakumicha, Your Excellency, the Governor of this great region of Meru, Your Excellency Kawera Mwangaza, Members of Parliament, PS Harry Kimtai, and all protocols observed. Habari zenu. Madam CS, allow me to introduce my board. Wasimame tu pahali wako and wave. Thank you. Let me also record.
Kidogo. Sawa sawa. Wale wako nyuma tunaweza nyamaza kidogo tafadhali. Naona kuna zile activities zinaendelea huko. Tutaomba sana tuende kwa utaratibu. Wale wanaenda kupata matibabu huko nje, ukitoka tutoke kwa utaratibu. Madam CS, at this juncture, allow me to invite one of our partners to represent the other partners, and I will be asking, first of all, to start with the communities of people living in HIV, represented here today by the National Network of Empowering People Living with HIV and AIDS, which is NEFAC. Nelson Otuoma. After Nelson Otoma, we'll have a few remarks made by Brian and Medine, as well as one of the leaders here from CHAC. And thereafter, we'll be concluding this program for this session.
Thank you, Dr. Ruth. Good morning. So our chief guest, Madam CS, Her Excellency the Governor for Meru County, allow me to say all protocol observed so that I do quickly in the interest of time. And for those who know me, I work at NEFAC, and for the last 10 years I've been at NEFAC attending World AIDS Days. I've never had a speech, but today I have a speech because the people who have sent me here are watching, they are in the room. I may lose my job if I don't read it very quickly, but it will take the time that I've been allocated. So I'm saying this is extraordinary because we have World AIDS Day where the theme is led, communities led. And communities are playing a great role in this country. And we think that if communities are enabled and empowered and resourced, then we are able to deliver on the HIV 95 targets and put Kenya in the path to end AIDS by 2027. Of course, globally they are talking about 2030. In our country, we are always reminded that it is 2027. But communities, the role they play, I want to explain that when we talk about community health promoters, that is the boundary between communities and the government, because those are government employees. But we also have community actors that can be very useful, and civil society. And at this point, I want to tell the chief guest that as we will be winding, we will be launching a report of what civil society have been doing in this country to prevent HIV and to manage AIDS in this country. We are also glad to congratulate the Ministry of Health, because this is the first time we are meeting after the 4 laws. The bills stand into laws. And these bills, we hope that as we roll them out, communities will be engaged in the negotiations of guidelines and also involved in the task forces that are going to implement. But so far, so good. We want to congratulate the Ministry of Health. When it comes to HIV, we know we have done a lot of work. And I want to congratulate NASCOP and NSDCC because we have averted new infections and we've also prevented AIDS deaths. At that point, I also want to congratulate the Ministry of Health for putting up a plan to end AIDS among children. And that is where you need communities most. That is where you need people and women living with HIV to stand with you so that we win this war. And in winning that war, you will need to also resource communities. I need to also say that although progress has been achieved, there has been challenges. One of the greatest challenges remaining with us is stigma and discrimination. HIV-related stigma and discrimination is the reason why today we are testing people here free of charge. Probably only a few people will present. Even those who are tested are not taking up treatment, therefore presenting with advanced HIV disease, which is AIDS. So I want to call upon the Ministry of Health to work with us as communities to fight stigma and discrimination, and also to remind them that fighting stigma and discrimination costs money the same way ARVs also cost money. I need to point out that one of the things we regret is that for people who have HIV, when they are sick of TB. When they die of TB. And therefore it is regrettable that today we are commemorating this day when we have intermittent supply of commodities. And we hope that this can be resolved soon. Almost ending, I want to say that Kenya treatment has been successful very much, Madam CS, and we thank you and the government so much. And people who have lived with HIV for long, and now they are presenting with non-communicable diseases. I want to single out particularly hypertension and diabetes. And therefore, we need integration to be strengthened so that people who have HIV also are checked for non-communicable diseases. And that is our excitement when we talk about the new health laws, including chronic and emergency illnesses fund, because we hope that we can be there. And I'm echoing this because, Madam CS, while in Kericho, you said you are going to be inclusive and HIV will be part of package of services that we are going to roll out. And recently, when we were commemorating PEPFAR 20 years, the President himself said that HIV will not be left behind, and that is the way to go, and we will continue consulting. And I want to assure you that even as communities, even people living with HIV, they have the skills, they have the knowledge to help you roll out this plan and to move forward. Lastly, and more importantly, I have been reminded by a team at NEFAC that we are commemorating PEFA 20th anniversary. And I'm mentioning NEFAC because if new HIV infections were prevented, then they were prevented in the NEFAC members and their loved ones, including children. So thank you very much, PEFA. And if deaths were averted, then it is the deaths of communities that today are in this room. If there was no PEFA Global Fund, Government of Kenya, they would have not been here today. I think I just want to end by inviting us, the dignitaries, because apart from the CSO's report, we have in that corner a strategic plan by the network of elderly persons living with HIV that I will say more when the time comes. Thank you very much and welcome. Asante.
Thank you very much. Wananchi mmesikia kutoka kwa NEFAC, communities are excited that there is no longer going to be any exclusion in the social health insurance fund. Tupigieni serikali makofi for once. So at this juncture, allow me now to invite Brian. Brian is also celebrating 20th birthday of the President Emergency Fund, which is US taxpayers' money that most of us here may not be aware that has been contributing to the success we see today. Brian, karibu sana.
Asante. CS, Governor, please, all protocols observed. I have limited time, so I want to really try to get through this quickly. I'm really happy to be here in MERU County to celebrate World AIDS Day. You know, PEPFAR also has a moniker for World AIDS Day that is Remember and Recommit. So in doing so, we're looking at our 20th anniversary. And, you know, 20 years ago, George Bush signed into law the law that created PEPFAR. And it was at a time when there was a great global health emergency. There were millions of people across Africa living with HIV and AIDS with no access to treatment. And I remember at the time I was living and working in Botswana, and I would go from hospitals to hospital, and people were just lined up in the hallways waiting to die because there was no treatment available, and doctors couldn't do anything. They could just only walk by. So it was really a great inspiration to hear that we started PEPFAR. Since the start of PEPFAR, we've saved more than 25 million lives across more than 50 countries. And we're working now in Kenya with more than 1.3 million people living with HIV on treatment. Through this unprecedented partnership with the government of Kenya, PEPFAR has changed the course of HIV pandemic in the country and having an indelible mark in its restorative and transformative history. AIDS-related deaths have declined by 68% from 2012, and while new infections are down 78% in the same period. PEPFAR investments have ensured also that 150,000 babies are born HIV-free since 2004. PEPFAR continues to contribute to the creation of resilient public and community health systems in Kenya, creating a future and a hope for so many people. These efforts have built and continue to build a strong health infrastructure in the country, improving health security responses and other health crises such as Ebola, cholera, and of course, COVID-19. As we celebrate 20 years of this impact and work towards accelerating the progress needed to achieve HIV/AIDS pandemic control in Kenya, I welcome you and your loved ones to visit the Kenyan National Library Services in Upper Hill, Nairobi, and explore the exhibit that we've put up that celebrate 20 stories of heroes that some are living with, some have been affected by, but they really exemplify the magnitude of PEPFAR's impact in Kenya. The exhibit will be up through December, and so please journey with us to tell the stories of these great heroes. As we celebrate PEPFAR's 20 years of impact, we have more work to do to reach the UNAIDS goal. UN goal of ending HIV as a pandemic by 2030, or here by 2027. We cannot achieve our goal of ending HIV/AIDS if we deny people's rights or allow stigmatization and discrimination against people living with HIV or those who are most vulnerable to acquiring HIV. So, working in partnership with the government of Kenya, multilateral and regional partners, people living with HIV, NGOs, and other stakeholders, I'm confident that together we can secure the gains that Kenya has made over the last 20 years. I join with you today in remembering how far we've come in the response and recommitting to the end of HIV/AIDS as a public health threat, as promised by President Ruto. PEPFAR shows that we can do what we can do at our best, working together across divides in partnership with the rest of the world to make progress against a seemingly intractable problem and preserving millions of lives. Let's learn from it and build on this life-saving work. Asanteni sana.
Thank you very much, and karibu sana Waziri Bore. Let us celebrate PEPFAR at 20 before Medine comes in. MC, tafadhali makofi ya PEPFAR, so that Brian can take back to the American people the greetings from this gathering. Kusema asanti sana PEPFAR. Makofi kwa PEPFAR. Makofi kwa PEPFAR. This is mrefu.
We can do better than that. Can you appreciate PEPFAR better? Okay, tuinue mikono juu. Tuinue mikono juu. Mikono yote mbili juu tafadhali. Are we ready? Are we ready? And remember, we are live. Okay, if I say 2023, we all clap non-stop. Okay? 2023! 2023! Last one, 2023! Thank you so much, Daktari.
Thank you very much. Excellency Susanna Kumicha, Cabinet Secretary for Health, Excellency Governor, communities, and people of Meru. I have learned to say this. All protocols observed. On behalf of the United Nations in Kenya and my own behalf, I congratulate the government of Kenya, communities and all stakeholders for the great stride made in the AIDS response. I also wish to congratulate the government of Kenya and specifically our cabinet secretary for the ambitious target that you have set to end AIDS by 2027 that none of the other countries have made. So congratulations once again. Another great news is that Kenya will be leading the UNAIDS Governing Board in 2024, and it's not only for Kenya, but it will be shaping the agenda of ending AIDS, ending inequalities by 2030, and thank you so much for representing us in this global platform that will influence and inspire the whole world. So thank you so much for that leadership. UNAIDS has identified the global theme, the one that we see, let communities lead, for this year's World AIDS Day commemoration. And here we are amplifying the role communities played in the AIDS response and making a call to action to fully support communities' life-saving work and to remove the barriers that stand in their way. In 2021, member states of the United Nations, including Kenya, renewed their commitment to supporting communities in the design, implementation, and monitoring of the AIDS response. This includes harnessing the power of partnership, partnership to and enabling regulatory and legal environment that allows them to operate and protect human rights for all. Communities have vast experience. They know how best to design HIV strategies and reach people most in need of services and connect people to facilities. The UN in Kenya has identifying ending the triple threat as one of the flagship program for the next 4 years within the UN Sustainable Development Cooperation Framework. And I want to reiterate our commitment, again, on behalf of UN, that we are going to work very closely with government, with communities, with partners, to make sure that we see zero new HIV infection, zero teenage pregnancy, and zero AIDS-related deaths. I thank you very much for your leadership, and we are here to work with you very closely. Thank you, people of Meru, for hosting us today. Thank you.
And finally, Waziri, I would like to, before we go to the next level of program, to invite Dr. Mwenda from the Christian Health Association of Kenya to just make 2 minutes remark on behalf of partners who support us from the Christian family.
Our chief guest, CS for Health, Our Excellency the Governor, other elected leaders, distinguished visitors, our partners, na wasalimia wote. Bwana Yesu asifiwe. Our chief guest, I'm indeed very delighted. And as a son from this county, it indeed gives me great pleasure to have this opportunity to say just very few words on behalf of the faith-based community. The Christian Health Association of Kenya, where I serve as the General Secretary, has been a partner with this county of Meru and indeed many other counties, total of 15 of them, through funding support from PEFA, USAID, CDC. We have 2 projects here, USAID Jamii Tekelesi, which is working right here in Meru, together with CHAPS Tawisha, and we partner with the Meru County government in providing all HIV services from prevention to testing, treatment, care and support, including supporting OVCs. But as you are aware, FBOs have been an integral part of the HIV response in this country, across the entire country. And it is our commitment, right from the communities, our places of worship, the programs that we run through the churches and other religious institutions, and of course our mission of faith-based health facilities. We consider is our part of our Christian calling, and indeed a responsibility to provide the whole range of services, of course with the leadership of your ministry and following the guidelines that are provided. And I want to take this opportunity to congratulate His Excellency the President, you the CS, and the entire leadership of the government for launching or relaunching UHC in this country, and for the commitment you have given us as an entire nation that we are going to transform healthcare. And this is our passion as FBOs, and thank you for putting us at the center of this. Ours is to give you a commitment that will support you, will support the county government across the country as they deliver services, and as FBO health facilities, we will be right in the middle of, with you in driving that agenda. I also want to acknowledge the opportunity we've been given by USAID through our sister organization MEDS to support delivery of HIV commodities across this country, and it's a responsibility we take very passionately, and we are committed for as long as we are given that opportunity to continue that service. So I want to wish you all well and God's blessings as you celebrate this great day and as we continue serving the people of Kenya. Thank you.
Thank you very much. Waziri, we are here in Meru County for a number of reasons. And one of the challenges we are facing in Meru County ni mimba za utotoni. Tulipoangalia data ya hii mwaka peke yake, tunaona Meru County iko na idadi kubwa sana kwa nchi mzima ya watoto wenye wanaenda clinic kabla hawajafika miaka 19 kurudi hata kwa miaka 8. Na hiyo maneno tulipotufikia, tuliita wazee wa Ncheke. Na wakafika pale Nairobi. Na nikawauliza, wakati tunajua vile Meru inaendelea, tunajua kwamba wazee wakiwa pahali lazima wapate suluhisho. Na wazee wa Njori wakakuja wakakaa, tukarudi hapa tena, tukakaa chini nao tena na chairperson wetu, na wakasema wako tayari kufanya kazi na gavana wetu. Ndio hiyo maneno yote ya watoto kupata mimba za utotoni ikome. Your Excellency, tuliweza kwenda hospitalini, tukaenda kwa community huko Motuati, na tukaona na tukasema hiyo data tunapata huko Nairobi ni data ya ukweli. Na kwa hayo machache, mzee mmoja wa Njori anataka kutuambia message ile inaenda nyumbani, message ni 3. Njori Ncheke imeamua aje?
Asante sana Madam CEO, Mheshimiwa Waziri wa Afya, Excellency the Governor of Meru, Kawira Mwangaza. All protocols observed. My name is Josephat Murangiri Kirenya, Secretary General of Operations Ncheke, Supreme Council of Meru Elders. Sisi, we have committed ourselves, kama wazee as gatekeepers, that there is no genital mutilation again in Meru. Na hiyo tunasema ni lazima. Tumecommit ourselves. Hakuna mimba za mapema. Hiyo wazee wamesikiria. Na tumesema to manage wale wameathiriwa na HIV AIDS na tusuie maambukizi mapya. That is our commitment, and we have an MOU with the National Systemic Disease Control Council. Asante sana.
Thank you. Thank you very much. MC, labda makofi ya mwisho kwa wazee wa Njori Ncheke, kwa sababu kwa hii jamii ya Meru, Njori wakiongea, wakishikana na governor, hiyo maneno ya mimba za utotoni itakoma. Wale wa Meru mko hapa, si mnajua hivyo? Si mnajua hivyo? Wacha Your Excellency nitaje ya kwamba tulisikia jana hata County Commissioner atatuelezea, akienda huko kutafuta wale watu wameshika wale watoto kwa nguvu, wananchi wanawaficha. Na wanaficha kwa sababu wanasema familia ya hiyo, ile familia imefanya hiyo madhara na hii ingine imefanyiwa ni watu wa Geshiaro. Na ndio tukasema kutatua Geshiaro ni wale wazee wa Njori Ncheke ndio atatatua hiyo maneno ya Geshiaro, ndio wale watoto wapate justice na pia waweze kurudishwa shuleni, na wale watu wanashika watoto kwa nguvu pia waweze kupata ile tunasema wapelekwe kwa formal justice system. Na hiyo nimesikia kabisa Njori ya Meru haiko pamoja na wale wanafanya kangaroo court. County Commissioner hakuna kangaroo court. Ukisikia kangaroo court tena Njori iko hapa na wamefanya commitment. Asanteni sana, na MC tupigie makofi.
Aya, makofi ya Njori Ncheke. Are we ready? Are we ready? Tunaanza na moja. Tuanze kidole moja hivi. Tunapiga piga Njori Ncheke, tupige piga haraka. Weka mbili, weka tatu, weka 4. Njori Ncheke. Thank you. Asante daktari.
Thank you very much. And I would like to take this opportunity to invite the CC of Meru County, who is making a few remarks. Your Excellency, as you're aware, Meru County has a very effective program for prevention of mother-to-child transmission of HIV. Na leo, waziri hapa anasema ako na wamama anataka kuwapea certificate, utapewa certificate baadaye, lakini atachukua hii nafasi kidogo tu dakika 2 kumaliza haya.
Thank you. Madam CS, Your Excellency Governor, wageni wote wenye wamekuja hapa Meru, habari yenu? Good morning. Is it morning or afternoon? Good morning. Bwana Yesu asifiwe. Afya yetu? Afya yetu? Thank you very much, Madam CS. Today I'm very delighted to be here, and I'm very, very happy. I'm actually one of the happiest people in Meru today. Mine is not a lot, is to welcome you here for this event. We have been organizing this event for the last 2 weeks or 3 weeks with the CC Meru, who is here, Mr. Dunga. I recognize you, and we are very, very happy that this one has come, and it is a very big success. Now, today we are having a very big problem, Madam CS, of the early pregnancies, especially in parts of Igembe and Tigania. That is one of the biggest problems that we are experiencing in Meru. The other problem is mother-to-child transmission. There's a lot of, because of the age of the girls who are becoming pregnant or who are delivering, there's a lot of mother-to-child transmission. And today I'm happy to inform you that we have graduated advanced EIA graduation, and we are graduating 134 children who have actually turned negative or who have tested negative. And I've been delighted to give you the certificate so that probably you can issue to one of the coordinators. We are happy that we have Opoundwent, which has been supporting this program. We have so many other partners who are supporting us on this. The transmission of ends, the early pregnancies, the triple threat actually. So for now, I would call upon the CS, Madam Susan, to come and issue this certificate to one of the coordinators. I would call also the coordinator to come in front so that they can be given these certificates. Dr. Rena, where is the, very good. Yeah, this is the coordinator. Thank you very much, Madam CS, for that. Otherwise, mine is to welcome you to Meru, all our visitors. Karibuni sana Meru, and let us work together with the communities. Asante sana. Thank you.
Thank you very much. And congratulations to the mothers that have had their children graduate. Your Excellency, graduation inamaanisha mama alikuwa ametest, akapatikana ako na HIV, alikuwa na mimba, akapewa madawa, akafuatilia madawa mpaka wakati mtoto akazaliwa. Wakati ananyonyesha akaendelea kutumia ile madawa, alafu alipoacha kunyonyesha tumepima mtoto na mtoto tukapata akupata kuambukizwa HIV kutoka kwa mama kwenda kwa mtoto. Lakini ningependa kugusia jambo moja. Tunasema mother to child transmission. Lakini wananchi kuna kitu inaitwa father to mother to child. Na watoto wengi tunaona wanapata HIV wakati wa kunyonyesha. Na wananyonyesha wakati tumepima mama ametoka kliniki, hana HIV, ameenda nyumbani. Wakati mtoto anaenda kliniki, after some time anapatikana ni mgonjwa. Na ndio maana tuna lose so many children to AIDS because wamama wanafikiria walipimwa wakaenda. Lakini father akapea mother akapea child during breastfeeding. Njori ncheke pia, hiyo si ni jambo lile mtaongea huko nyumbani. Wazoea wakipata watoto pia wako na jukumu ya kuwachunga. On this note, allow me to invite our county commissioner a very able county commissioner, a man of God, a man of unity, Frederick Ndunga. Tumefanya naye kazi miaka mingi, and Your Excellency, nasema Meru mko na bahati sana. Ama nasema uongo? Wa Meru mko na bahati? Haya.
Thank you very much, CEO. Mgeni wetu wa heshima siku ya leo, Waziri wa Afya, Madam Susan Nakhumicha Wafula, pamoja na waziri mwenzako, Your Excellency the Governor of Meru, Kawira Mwangaza, PS wetu wa Medical Services na viongozi wote, na watu wa Meru, hamjambo? Hamjambo tena? Kwanza kabisa nijiunge na gavana wetu kualika wote ambao wametoka nje ya Meru. Karibuni sana Meru. Jambo la pili, mgeni wetu wa heshima, nataka nikuhakikishie mimi pamoja na serikali ya kitaifa ambayo iko chini yangu katika Meru, kuna mambo matatu ambayo tutayafanya kwa bidii. Jambo la kwanza, sensitization kwa mabaraza zetu zote, na kila mtawala ana mabaraza mawili kwa mwezi. Swala ama jukumu muhimu ni kusensitize watu. Jambo la pili, coordination. All the players wale wanashughulika katika mambo ya ukimwi na pia the triple threat, sisi ni kuwa coordinate wote kuhakikisha ya kwamba wanafanya kazi in harmony. Lakini jambo la tatu, mgeni wa heshima, ikiwa mambo hayaendi vizuri, enforcement, na hiyo ni kazi yetu. Kwa hivyo nataka kwa ufupi sana ni wasimamishe mahali walipo tu Deputy County Commissioners ambao mumehudhuria, simameni tu mahali mlipo, wasindikizeni kwa makofi mazuri. Salute the guest of honor, ketini chini. Assistant County Commissioners ambao muko, simameni. Salute the guest of honor, ketini chini, asante. Machifu ambao muko na sisi, simameni mahali mlipo. Salute the guest of honor, ketini chini, asante. Assistant Chiefs ambao muko hapa, simameni. Salute the guest of honor, asante, ketini chini. Village managers, wale area managers, kama uko hapa na we ni area manager, simama tu mahali ulipo. Heshimu mgeni wa heshima, ketini chini. Asanteni sana, hayo ndio nilio nayo, na kwa taarifa yenu, mimi ni mchungaji. Na mgeni wa heshima, nilipoona tumeimba wimbo wa kitaifa na tukaendelea na program na hatukuomba Mungu, kidogo nilisikia kama roho yangu imegusika. Asanteni sana na Mungu awabariki.
Thank you. Thank you.
Thank you very much, Commissioner. Nasikia wewe ndio ulichelewa maombi, kwa hivyo uhudhurie maombi ya kufunga. Asanteni sana. Allow me, guest of honor, waziri wetu, to invite Honorable Patrick Munene to speak on behalf of Parliament, both houses, and to bring us a message from that house.
Thank you. Asante Dr. Masha, CEO National Academic, waziri wetu Susan Nakhumicha Wafula, waziri Bole, the PS Haliki Mtai, governor wetu wa Meru, patunasemaga governor ni mama, all protocols of served county commissioner, pastor ambaye alichelewa maombi. Bwana Yesu asifiwe. Niseme mimi sina mengi ya kusema. Majina ni Munene, mbunge wa Chuka Gambangombe, Tharaka Nithi County, and waziri, we are happy to be here today. Governor, I was telling Governor Kawela that this thing is bigger than any political rally. And it gives me a lot of happiness when I see Kenyans turn in big numbers to discuss matters important to their health. It means now Kenyans, you have known the important things to discuss, not politics. Because seeing everybody here today, and this has been happening in Meru for the last 3 days, there have been activities, it means that now we are discussing things that are important in this country. Finally, Waziri, I want to congratulate you. Since you came to the helm of the Health Ministry, me as the Vice Chairman of Health, I've seen you profile health in this country and the discussion of health in this country to very high levels. Because people don't sort problems until they start discussing them. The fact that Kenya now is discussing health as a key issue, including the president now has placed health as a key issue in this country. Waziri, I want to congratulate you with your ministry. You've done a good job. The governor of Meru County, Kawira, we want to congratulate you also for putting up this. We know you have been under a lot of pressure of late, but you managed to put up this. Kawira, this is beautiful. Governor, this is beautiful. And from Parliament, I want to thank you and thank the people of Meru. You have given us a good welcome, and you've shown the country that Meru is still united and Meru is still together. To the National Academic from the board and the CEO, I was with you in Mombasa, in the Maisha conference, and I've seen you do a wonderful job in the HIV/AIDS area. And to our donors, you've never got tired of us. You have been with us throughout. I've been with you so many functions. Our donors, I want to thank you on behalf of Parliament and tell you and urge you to continue supporting us. And finally, Waziri, when I attend these meetings, Dr. Masha always tells me, remember you started your career in National AIDS Control Council, so you need to discuss HIV. Waziri, you know, Waziri has never known I'm a health worker. Waziri, you know, the common assumption is that HIV is spread by commercial sex workers. But I want to tell you, Waziri, HIV is not spread anymore by commercial sex workers. The most careful people in this country on HIV are commercial sex workers, I tell you. HIV is spread by me and you seated here. Ile uliona kupima ya macho hapa. Kiangalia Waziri unasema hii ni negative. Hii ni negative. Hii kupima ya macho ndio iko na shida. Tukiacha hii kupima ya macho, hii ukimwi itaisha hata before 2027. So mimi alaja wa people, tuacha hii kupima ya macho. Tuliambiwa, look at the person seated next to you. CS Bole, look at Tariq Mutai. That's how people with HIV look. So usianze kutafuta wale wako na ukimwi wanakaa aje. Look at your partner, that's how they look. So once we trust that and we be careful, I know Kenya will achieve this target of ending HIV by 2027. Once again, to the great people of Meru, on behalf of Parliament and the Committee of Health, I want to thank you. Waziri, congratulations. You have done well, and we are so proud of what you are doing in the ministry. Thanks so much. We have a former member of Parliament there. He is looking at me and said, Honorable Kabeabea, that's a former member of Parliament for Tigania East. He is also a board member in KEPS, so he is one of us. So Waziri Kabeabea, karibu sana. Karibu nikuite Waziri Kabeabea na hujafika kule. Hapa chini bado kidogo. So mimi nataka kusema asante, and to Masha, congratulations. You've done a good job. Na watu wa Meru kama hamkujua, unajua Masha akiongea kizungu nyingi hapa, alafu anaita wazungu anakaa ni kama ni mzungu pia. Hii ni msichana ya Meru. So tupigie Masha makofi.
Thank you very much. And maybe before, sasa mmesikia kuna msichana wa Meru. Before I hand over to our PS to invite our governor, the governor to invite Waziri, allow me to also say, tuko pia na kijana, rais amepea kazi kwa health. Daktari Duranera, simama wa Meru akuone. Tafadhali. Niruhusu niseme kitu moja. Huyu kijana ndiye anafanya na waziri na anasaidia waziri na ile kazi munaona hata ya Social Health Insurance Authority. Wa Meru, si munafurahi sana? Asanteni sana. Governor, unaona sisi rais wetu pia anapenda wa Meru sana. Anawapea kazi kubwa kama ile amenipea, ile amepea Duranera, na kwa hivyo akifika huku unamshukuru sana. Asante sana. PS, karibu sana.
Basi asante sana CEO wa National Syndemic kwa kazi nzuri ambayo umefanya. Waziri Susan Nakumicha ambaye pia leo ni mgeni wa heshima katika hafla hii ya sherehe ambayo tunaadhimisha, sherehe ambayo ni kubwa sana, sio Kenya peke yake bali ulimwengu mzima. Gavana wetu wa jimbo la Meru, Gavana Kawira Mwangaza, tumefurahia vile umetukaribisha Meru hii na vile umeita watu wako wa Meru wote wamekuja kutukaribisha. Waziri wetu wa Leba, Madam Florence Bore, asante kwa kujumuika nasi siku ya leo. Mheshimiwa rafiki yangu Patrick, sikujua kwamba wewe ndiyo CHP number 1. Tumpigie makofi CHP number 1. Na alihakikisha kwamba sheria za CHP zimepitishwa katika nchi yetu. Asante sana. Sisi County Commissioner, wafadhili wetu ambao wako hapa, Brian, Dr. Medin na wengine ambao wamekuja hapa, nataka niseme asanteni sana kwa kuja kujumuika na Wizara ya Afya wakati naadhimisha siku hii ya muhimu sana. Ya muhimu, na nafikiri nataka tuseme kwamba tujue kwa nini tumekuja kusherehekea hii siku ya AIDS, World AIDS Day. Ni kwamba tuwaletee ujumbe ambayo inasema kwamba wakati huu kuendelea mbele, lazima sasa tushukulie mambo ya kusema tukubalie jamii ishike doria, iwe ya kwanza, iwe mbele. Na nimefurahi sana kuhakikisha kuona kwamba jamii ya Meru sasa kupitia Njuri Njeke wamekuja mbele hapa na wametuhakikishia kwamba watakuwa katika mstari ya mbele kwa mambo ya HIV/AIDS. Nyingine ni wale ambao waliadhirika na mambo ya AIDS, kwamba hamujanyamaza, hamujakaa nyumbani, hamujakaa pembeni, mmejitokezea, kwa sababu leo tumetembea kule ndani vibandani, mmetuonyesha kwamba mko na mnashirikiana na serikali kuhakikisha kwamba mambo ya AIDS inawekwa kipao mbele. Tuwapigie makofi hawa jamii. Shukrani sana wafadhili wetu. I want to say, Brian and team, we are so grateful for the development partners that you have supported the government of Kenya to ensure that we continue providing quality care to those who have been affected. Indeed, from our statistics and from our data, that if it were not because of development partners, the number of people who will have died because of HIV will be phenomenal. But this has been possible. And I'm told in Meru County, there are 3,200. We want to thank you, Excellency Governor. CHPs wetu mkaya, nyinyi ndio mashujaa wetu kule mashinani. There is no any other way that we are going to bring revolution in health if we do not empower the communities. Together with the national government and the county government, we are going to work in partnership to ensure that this time round it works. The President has said it must work. Excellency Governor, we have no choice. My Waziri, we have no choice. I myself, as a Principal Secretary in the State Department for Medical Services, I will support you to ensure that we deliver on His Excellency agenda. Finally, I know there is a challenge. The new challenge that we are facing. We are seeing the number of cases increasing, especially on the youth. Especially on the youth. As we continue fighting, we have a challenge that we must face. One, through gender-based violence, which is becoming a threat. And I'm very happy that, County Commissioner, you have aligned your team. That you have aligned your team, that in every meetings that you have with the community, you discuss about issues of gender-based violence. The latest statistics shows that the number is going up. But we are keeping quiet, we are not discussing about it. Today, I also witnessed Njuri Njeke confirming that they are going to talk about it. Na mali mimi natoka waje nielezee. We know that Njuri Njeke akishaongea, hakuna Meru ambaye atapita kando. Kweli si kweli? Kwa hivyo nataka tushikiana pamoja na jamii kama hao, viongozi kama hawa. Pia nimeona wale watu wa kanisa wamekuja mbele, wamesema sasa tutakuwa tunaongea yake. Lakini nataka niwaachie neno moja. Mambo ya gender based. Mambo ya gender based nataka tuongelee sana. Na lazima pia tuseme kwamba usinyamaze. Usinyamaze. Tunasema sasa piga nduru. Tunaelewana? Hebu tupige nduru kwa sababu ya hiyo maneno ndio tujue ukipatikana naye unapiga nduru. Tupige nduru. Haya. Tupige tena nduru. Bas sasa mambo ya gender based ukisikia wewe ukiwa affected piga nduru. Asante sana. Kwa hivyo sina mengi ya kusema, nataka nichukue nafasi hii nimkaribishe gavana wetu. Na asante sana gavana, tulipofika kule hapa Meru tuliulizwa tukaambiwa tulijaribu kuongea sema tunasalimiana vipi. Tukasema ukishasalimiana kwamba habari alafu nasema si ndio? Kwa hivyo nataka niseme ukuje utusalamie, kuja tuongeleshe, alafu baadaye uendeshe hii program yetu. Welcome. Tumpigie makofi gavana wetu anapokuja. Tumpigie makofi tena. Tuendelee kumpigia makofi. Tumpigie gavana wetu mpendwa makofi. I know Governor Bishop Kawira is a tough lady. She's the new tough lady of Mount Kenya. Asante sana. Welcome.
Asante sana. Yes. Bwana asifiwe. Bwana asifiwe. Mugeni Antoba Meru. Mugeni Kaere. Madam CS, our chief guest. Susan Nakumincha, our beautiful girl. Tuko na waziri mwingine, rafiki wangu sana. We served in the 12th parliament na wewe. Na ni waziri wetu, karibu sana. Mrs. Mary Murioki, PS, Public Health and Professional Studies. Frederick Dunga, County Commissioner wa Meru, mtumishi ambaye alipotea wakati wa maombi, akakuta imeisha. National government officials, county government officials, partners, community living with HIV, our guests, ladies and gentlemen. Mugeni Kaere. Hapa Madam CS, tunasema maendeleo yetu ya Meru ni 800 kilometers per hour, na tumesema ni ya kabati kaende. Kabati kaende. Kabati. I'm so delighted and happy for the privilege the National Syndemic Disease Control Council has accorded Meru County, holding the 2023 World Day commemoration at Kenoru Stadium, where we are today in Meru County, is not only an honor but a big favor and a boost to the health care and economy of our county. We will forever be grateful. As the world and the country celebrate the struggles and the resilience of those who have put a brave fight that has led to success, progress in HIV response, I am happy because Meru County has been a major beneficiary in these milestones. I will not dwell much on how many reductions in new infections or HIV-related deaths in the county recorded, but today I will focus on the importance of involving communities and taking health care services to the people's doorsteps. Meru County has an estimated 30,000 people living with HIV, out of which 26,000 have been tested. 84% of these, that is 22,000, are already on antiretroviral therapy. One of the major impediments to the progress in health care is HIV stigma. This deeply rooted societal challenge deters individuals from seeking testing and treatment. I wish to call upon every one of us to embrace compassion and love and offer equal treatment to all people regardless of their HIV status. As a county, we are also committed to fostering the government's commitment to ending HIV in children by 2027. This goal calls for a strategic approach that focuses on enhancing antenatal care, expanding access to HIV testing and treatment for expectant women, strengthening the elimination of mother-to-child transmission program is at the core of our prevention strategy. This is in line with the government's dedication to creating an HIV-free generation. Our primary health strategy centers on empowering community health promoters, ambao wako hapa sana kwa wingi leo, tumesema ni madaktari, and enhancing the infrastructure of our hospitals and dispensaries. This approach aims to ensure the accessibility of health services to every resident of Meru. By prioritizing primary health, we are laying the foundation of an inclusive healthcare system that addresses the needs of all the people. Through this strategic focus, we aspire to create a healthy society where equality healthcare is rendered available and easily accessible to all. This will ultimately enhance HIV prevention and treatment with the free access to services such as HIV testing, pre-exposure, post-exposure, prophylaxis, prevention of mother-to-child transmission, as well as antiretroviral therapy for the people living with HIV. Bwana asifiwe. The time has come for us to let communities lead and pave the way for more resilient and impactful HIV response. Waziri wetu, bila kupoteza muda, nataka kusema asanti kwa kufika. Asanti kwa kufika Meru. Na ninamshukuru Mungu sana kwa sababu ya serikali yetu ambaye imejikakamua kabisa kuhakikisha ubora ama afya yetu iko sawa. So without wasting time, Madam Waziri, ningependa tu kuambia jambo moja. Community health promoters wetu ambao ni 3,716 wote wamereceive kits zao ambazo President wetu William Ruto kupitia waziri wetu Susan Nakumisha alisema sisi kama magovernors tuhakikishe ya kwamba wamepewa. Makofi kwa Olekina, Senator Olekina, karibu sana Meru. Asante sana, karibu. Waziri wetu Susan Nakumisha, leo ndio siku peke yake ambaye tumepata pengine break ya mvua. Kumekuwa na mvua throughout na watu wengi sana wameweza kuadhirika na El Nino, na ni ombi langu kama kiongozi na gavana wa Meru ya kwamba ukirudi kwa ofisi kule pengine utapata net ambazo zitasaidia watu wetu kule mashinani. Na pia kwa sababu wewe ni mama mwenzangu, ukipiga round yuko kwa serikali kubwa, utapata chakula kidogo na vitu kidogo vya kusaidia watu ambaye wameteseka kwa sababu ya mvua kubwa ambaye inanyesha Meru. Kwa hivyo waziri, ninakuomba kama mama, ukifika kule Nairobi, piga hodi kwa milango tofauti, enda kwa waziri wenzako, at least watuletee hata kama ni maharagwe na nini kutoka national government. I want to say that we've received nothing from national government ya kusaidia upande wa El Nino, and our budget ni kidogo sana, hatuwezi kuingia kama vile unaweza kuingia mashinani. Nataka kusema kwa waziri wetu ni asanti. Tumekuwa na mkutano na wewe asubuhi kwa ofisi yangu, and we have agreed that utusaidie. Our budget ni kidogo sana. Tuko na machines ambazo zinahitajika Meru Level 5 Hospital, ambazo sisi kwetu tukijikamua kununua inaweza kuwa shida sana, maana we shall have squeezed ama channeled all our funds to that particular machine, kama hii ya MRI ambaye hayuko kwa hospitali yetu. Kwa hivyo ukirudi Nairobi tupangie, maana inatukosti 450 million. Na tukipata hata kama ni deni, sisi tuko tayari tutalipa, kwa sababu hata hao wangwana huwa wanalipa hustlers fund. Kwa hivyo sisi tunaweza kulipa hii machine tukiletewa. Mwisho, Madam Waziri, nataka kusema ya kwamba Meru was ranked ama imekuwa namba 1 kwa upper and central eastern part in management of health products. Kwa hivyo sisi tuko namba 1 na tunaongoza. Hatuongozi kwa impeachment peke yake, tunaongoza kwa maendeleo. Ikifika kwa maendeleo sisi ni namba 1. Na tunaenda kabati, kaende. Kwa hivyo nataka kuchukua hii nafasi niseme ni asante sana kwa kutembea. Tumeongea mengi, sitarudia, lakini nataka kukukaribisha. Wewe pia ndio utatukaribishia waziri mwenzako. Kwa hivyo naomba sote tusimame kwa sababu ya mrembo wetu. Tumkaribishe kwa makofi jameni anapokuja. Asante sana. Naona dada yetu Masha anafika pia. Asante, karibuni nyote. Karibu waziri. Karibu. Makofi anapokaribia. Yeye ni mrembo kwa kazi na ni mrembo hata kwa sura. Makofi kwake.
Asante sana watu wa Meru, tunaweza kuketi. Sikujua ya kwamba kuna watu wengi sana hapa Meru. Na ninaona mpaka kule nyuma kwa tent. Watu wa Meru mugeni. Mko wazima? Asante. Kabla niseme machache, nimeona Senator Olekina ameingia. Na kwa sababu mimi ni mtu napenda kuheshimu watu ambao wamechaguliwa, nitamuomba aje asalimie watu wa Meru. Si namna hiyo? Karibu Senator.
Haya, watu wa Meru hamjambo? Hamjambo tena? Nasikia mnasema kaende kabati kaba? Basi waziri, unajua mimi nikuwa hapa, mimi nasimamia bunge la taifa. Na hii ni siku yangu ya kwanza kufika hapa Meru County. Na nimefurahia sana kuja kwa sababu tumekuja kuzungumzia mambo ambaye yametukera kwa muda mrefu, mambo ambaye bado inatuumiza kwa muda mrefu, mambo ambaye imetumia hela nyingi tu ili watu waweze kukubali ya kwamba kweli wale watu ambaye wanaugua wanaweza ugua na pia bado ni binadamu. Mimi ningependa kuzungumzia hiyo maneno tu, ile maneno mengine yetu tutazungumza baadaye, ama namna gani? Siku moja nitakuja kuwatembelea ili tuweze kuzungumza kusema moja mbili. Bwana waziri, niko na speech kidogo nilikuwa nimeambiwa lazima nisome. Kwa sababu ile kazi ambayo mnafanya bila sisi wabunge hakuna mahali itaenda. Ni kweli ama si kweli? Mtaniruhusu nisome kwa kimombo, itakuwa fupi sana. Alafu niweze kuketi. Nipasa kwa sababu nimefika leo asubuhi, nilikuwa last week nimekuja, nikatoka pia enda kuzungumzia maneno ya development ya Narok County. Today we are gathered here to commemorate International AIDS Day, a day that holds immense significance in our global fight against HIV and AIDS. It is a day to remember those we have lost, to honor the resilience of those living with the virus, and to renew our commitment to ending this devastating pandemic. HIV and AIDS has been a relentless adversary affecting millions of lives worldwide. It knows no boundaries, respects no borders, and discriminates against no one. It has taken away our loved ones, shattered families, and left communities in despair. But amidst the darkness, there is hope. Hope that we can overcome this epidemic. Hope that we can create a world free from burdens of HIV and AIDS. Today, We stand united as a global community to raise awareness, to educate, and to advocate for those affected by this disease. We must remember that HIV and AIDS is not just a medical issue. It is a social justice issue. It is a reflection of inequalities that persist in our societies. The stigma and discrimination that still surround this virus and lack of access to healthcare and prevention services for those who need it is the most. On this International AIDS Day, let us reaffirm our commitment to fighting against the stigma and discrimination that perpetuate the spreads of HIV and AIDS. Let us challenge the misconceptions and prejudices that hinder progress in our battle against the disease. Let us stand up for rights of those living with HIV and AIDS, ensuring they receive the care, support, and respect they deserve. We must also recognize the importance of prevention. Education and awareness are our most powerful tools in stopping the transmission of HIV and AIDS. We must empower individuals with knowledge, providing them with means to protect themselves and their loved ones. Let us break the silence, break the barriers, and break the cycles of new infections. In conclusion, our fight does not end there. We must also address the underlying social deterrences and determinants that contribute to the spread of HIV and AIDS. Poverty, gender inequality, lack of access to education, and limited healthcare services all fuel this epidemic. We must advocate for comprehensive and integration approach that address those roots, causes, ensuring that no one is left behind. And ensuring that no one is left behind. Today, we remember the countless lives lost by HIV and AIDS. We honor the memories of continuing the fight by working tirelessly to prevent new infections and by providing care and support to those living with the virus. We owe it to them, ourselves, and to the future generations, and I want to repeat that, to the future generations, to create a world where HIV and AIDS is nothing but a distant memory. Bwana Waziri, let us join hands across borders and boundaries, Bwana Governor, to build a future free from the burden of HIV and AIDS. Let us stand together, shoulder to shoulder, in solidarity with those affected by this disease. Let us all be the change we wish to see the world in today. I thank you very much.
Asante sana, Senator. Pigia Senator makofi. Sana nataka nikukumbushe, mimi si Bwana Waziri, mimi ni Bi Waziri. Pia Senator, nataka nikukumbushe, hapa Meru hatuna Bwana Governor, tuko na Bi Governor. Makofi kwa Bi Governor. Asante sana. Nitachukua fursa hii kumwalika rafiki yangu, waziri mwenzangu. Unajua hii serikali ya William Samoei Ruto tunafanya kazi kwa pamoja. Na nilimwambia kama vita ya HIV tutapigana kama serikali moja. Yeye ndio yule waziri anasimamia mambo ya labor. Yeye ndio yule waziri pia anahakikisha ya kwamba tuko na social protection. Social protection is empowering individuals, empowering communities. Anikamwambia lazima uje uongee na wetu wa Meru. Makofi kwa waziri Florence Bore. Mpigie akija, mpatie nguvu. Makofi, 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 makofi. Karibu sana Bi Waziri Florence Bore. Asante sana waziri mwenzangu Susan Nakumincha, PS wa Health Bwana Kimtai, Madam Governor wa Meru, rafiki yangu Gavana Kawera, Senator Kina, Mheshimiwa Patrick, na wananchi wa Meru, hamjambo? Bwana asifiwe. Nitaenda kwa ile laini ya Madam Governor, sijui inamaanisha nini. Kabati kabati. Madam Governor, utaniambia hiyo ni nini? I'm delighted to join my sister colleague, Ms. Susan Nakumincha, the CES for Health, and esteemed partners during this year's World AIDS Day 2023. It is worth noting that Kenya has come a long way in the fight against HIV/AIDS, reducing the prevalence from the first cases that happened about 4 decades. Thank you to the concerted efforts by government and its partners, including the global community. The theme, "Let Communities Lead," is a clear indication of the journey we have taken as a country in preventing and mitigating against the impacts of HIV and AIDS. This theme is a forward-looking rallying call to make HIV and AIDS response and management community-driven, hence making it more impactful and sustainable. I am particularly excited to ensure a whole inclusive response and the sector's recognition that HIV and AIDS can disproportionately impact categories of our population that exist with vulnerabilities. Some of these groups are the children and the persons with disabilities, which fall under my ministry, and it is my mandate. This therefore calls for interventions in order to match the response the most vulnerable categories of our population require. My ministry continues to work with the stakeholders in the child rights, for the child rights in Kenya. Health is a child's right as provided for in the Constitution and the Children's Act 2022. As a ministry responsible for implementing and promoting this act, I am glad that the Ministry of Health is making strides in ensuring health protection for our children through the launch of the plan to end AIDS in children by the year 2027. In Kenya, which was done in Kenya in Homa Bay in September 2023. Equally, the launch of the universal health coverage, which is heavy on primary health care and social health insurance, will also benefit our poor and the vulnerable population. I also wish to acknowledge that my ministry and the Ministry of Health have successfully collaborated to deliver successful programs. These programs include the Health Insurance Subsidy Program, which currently provides social health insurance to about 312,000 beneficiaries of the Inua Jamii Cash Transfer Program through the NHIF and through the Niche program in 5 counties of Kitui, Kilifi, West Pokot, Marsabit, and Turkana, benefiting about 18,000 Inua Jamii program households, with pregnant mothers and the children under 2 years through an additional stipend of 500 shillings. The Niche program has clearly demonstrated that integrated efforts through provision of additional cash and health education facilities provide a positive behavioral change leading to improvements of nutrition outcomes among beneficiary households. In addition, my ministry is also working closely with the Ministry of Health and the Ministry of Education in the development of the Kenya Integrated Early Childhood Development Policy 2023, whose goal is to ensure that every child has access
to holistic, inclusive, quality, affordable, and equitable early childhood services from conception to 8 years. Further, the review of the National Children's Policy 2010 has health issues well articulated in the draft policy to ensure that active participation of the Ministry of Health is included in the drafting process. We all agree that to realize the goals of ending HIV and AIDS is to call for the scale-up of multi-sectoral and integrated approaches. I call upon all the stakeholders present here to be able to put their efforts together and support the Ministry of Health towards the path of a world free of AIDS. My ministry stands ready to provide the necessary collaboration, especially in the areas of community mobilization and organizing a quest to letting communities to lead. I thank you all, and God bless you, and God bless the people of Meru and the people of Kenya. Wacha tu niseme kidogo kwa Kiswahili. Nimesikia ile shida ambayo iko kwa hii kaunti ya Meru, kwamba wasichana wanapata mimba kama bado wachanga. It calls for all of us to work towards mentoring and talking to our children. We will not leave it to the governor alone. We will not leave it to the county commissioner alone. You and I must work towards ensuring that we educate our children. I usually believe this generation of our parents, we are not doing what our parents did. We are where we are because of what our parents did. These future parents, these current parents, I included, we need to work extra to ensure that we educate our children. We've become too busy with our work, with looking for money, and forget to talk to our children. I went to a girls' camp that was organized by the church, and I was able to go to school. I never went for FGM. At this day and era, there shouldn't be FGM. We shouldn't be exposing our children to pregnancy at the age of 8 years to 19 years. They should be in school. Let's help them to know what is right and what is wrong on the internet, because now they have access to internet through the phones that we parents have. May God bless you. Thank you. Thank you very much, my sister, Waziri Florence Bore. Excellency, the Governor of Meru County, the one and only, Mama Kawira, Mama Mwangaza Kweli, PS Harry Kimtai, our honorable members of parliament, led by Honorable Patrick Munene, who is actually the vice chair of the Health Committee in the National Assembly, and our Senator Olekina, who is here, senior government officials, the communities, na watu wa Meru, hamjambo. Hamjambo tena. Meru naonekana hampendi wageni. Munapenda wageni? Munapenda wageni? God is good all the time. Asante sana. Today, I'm very happy to join you, Governor, and the great people of Meru County to celebrate this day. Many people are thinking that this is a Meru celebration. It is not just a Meru celebration.
This is a Kenyan celebration. And not just a Kenyan celebration, but a world celebration. The whole world today is celebrating today. So watu wa Meru mjue leo muko kwenye map ya ulimwengu wote. Nataka kuanza kwa kuwaletea salamu za rais wetu, Rais William Samoei Ruto. Mmepokea salamu? Thank you very much. Chini ya serikali yake, kupitia ile kazi amenipatia kama waziri, we are working very hard to ensure that as a country, we achieve universal health coverage. And I'm honored today, as I stand here, because there are many people who have been with us as a country in the fight against HIV, against AIDS. I want to celebrate the heroes, some who have even gone ahead. People like Muriuki, they were at the forefront of fighting stigma. But we have heroes and heroines of today. I want to celebrate Wapi Nelson. These are the people who are breaking the barriers of stigma. And as my friend as well, I want to celebrate. Anaitwa Patricia. Where is Patricia? Yes, these are the people who are helping us to fight stigma and ensure that we educate our people about HIV. On Wednesday this week, His Excellency the President, together with the Ambassador of the US and myself, and a number of you in this tent, and many Kenyans, we celebrated PEPFAR at 20. PEPFAR has been a great partner to this country. Nilikuwa naambia watu hiyo siku ya kwamba mimi wakati nilikuwa najitayarisha kwenda college, nilipata mawaidha 2 kutoka kwa wazazi wangu. Mamangu aliniambia uende usome, umalize, urudi hapa bila mimba. Na babangu ambaye nampenda sana na ni askari, akaniambia na wewe wakati uko shuleni unasoma, ujikinge sana. Sitaki urudishwe hapa nyumbani umewekwa kwenye karatasi ya plastic. Those years, people who had died of HIV AIDS were taken back to their villages in plastic bags. But thanks to PEPFAR, that we are here today. And the way we have been told by Mheshimiwa Munene, HIV AIDS haijiandiki kwa sura ya mtu. We all look alike. And that is the stigma that we must break. And I want to thank the people of America. Hadn't they paid their taxes, we would not have achieved the gains that we have achieved in management of HIV in this country. Tupigie Wamerekani makofi. Brian, you are here. Please take back our feedback and our appreciation to the people of America for paying their taxes. That's why today we can celebrate the progress that we have made. And you know, as we celebrate, at times people do not know exactly what it is that we are celebrating. In Kenya, we have over 1.4 million who are living with HIV. But the good story about it is that out of this, close to 96% are on treatment. And that is how we are managing to ensure that this does not spread further. For me as your minister, my joy lies in seeing the many people living with HIV, living a normal life. And that's why, with the instructions of the President himself, we have ensured that we deliver universal health coverage. And under universal health coverage, we are not leaving anyone behind. I have had many people criticize our plan. Many people criticizing even the laws that are now in place, the acts. I want to be categorical. In the Social Health Authority, we have no limitations, we have no exclusions. Whether a child is born with a congenital disease, they will be covered under the Social Health Authority. Haijalishi uko na ugonjwa upi, wewe utashughulikiwa na Social Health Authority. Wakenya mnajua sasa ile NHIF ambayo tuko nayo. Mara nyingi ukienda hospitalini utaambiwa mara hii kadi yako italipia kitanda peke yake. Ama unaenda hospitalini unaambiwa sasa wewe hii kadi yako ilikuwa na sessions 5 tu za dialysis na umepitisha hizo 5, wewe top up ndio usaidiwe. Mara mingi pia ukienda na hiyo card, siku nyingine ukifika unaambiwa system iko chini, kwa hivyo hautafanyiwa surgery leo, itabidi usubiri. Those are the things that the Social Health Authority is coming to sort out. Hayo yote ambayo nimesema, ambayo ndio upungufu wa NHIF, ndio kwa maana tuko na sheria mpya ya kukuhakikisha under Social Health Authority kila Mkenya anapata huduma ya afya na anaipata pale ambapo ni karibu na yeye bila kutumia pesa mingi mfukoni. Katika kiwango cha chini ambacho ni primary health care, serikali imehakikisha ya kwamba tuko na jeshi 100,000 community health promoters nchi mzima. Na hapa Meru over 3,700 community health promoters. Na watu wa Meru ndio mjue ya mama, mimi upenda pale wa mama wanaongoza sana. Hapa Meru, the 3,700 community health promoters, kila mmoja wao ako na kit ambacho ni chombo cha kuhudumia watu nyumbani. Na hiyo kit si pesa kidogo. Nikifanya hesabu ya hapa Meru, that is 129 million shillings. Na tena, our community health promoters wa hapa Meru, kila mmoja sasa ako na smartphone mpya. Ukweli uongo? Mumepata simu mpya? Simu nipigie makofi. Simu pigie Rais William Ruto makofi. Na simu pigie Mama Kawera pia makofi. Sisi ni watu wa kupanga na kufanya. Sio kupanga na story. Na nataka kushukuru governor. Of all the 47 governors, and I want to say without fear of contradiction or doubt, you are the only governor who has ensured and that each of her community health promoters has a kit. You are the only one. Of all the ones that we have distributed, different counties are at different levels of distribution. Lakini wewe 100%. And for that reason, count me as your partner. We shall use Meru County as a model on delivering health care. Na watu wa Meru, nyinyi mko na bahati. Last week, we had a stakeholders meeting at Kenya Medical Supplies Authority to recognize the efforts of different counties in delivery of health care. na huyu CEC wenu alirudi nyumbani na trophy for having been the best in this region on managing health commodities. Thank you very much, CEC. Endeleeni na kazi nzuri ya kunisupport. And they say, a good turn deserves another. Mkinitendea mema, nitawatendea mema. As we celebrate today, and those who have spoken before me have spoken about it, we have gaps as we try to manage our HIV/AIDS. And the serious gaps in Meru, one is the teenage pregnancies that have been talked about. Mimi nataka kuwasihi kama mama, tafadhali, tuwache wasichana wasome wamalize shule. Tafadhali. And last evening vile nilifika, nilipata muda wa kuongea na wazee wa Njurinjeke kidogo. Na nataka kuwashukuru sana, naona mko hapa. Na nikawauliza, kwa hii Njurinjeke wamama wanaruhusiwa? Wamama wanaruhusiwa? Wakaniambia tunawaruhusu kidogo tu, kwa sababu saa zile tunasikia njaa kwa mkutano, lazima watuletee uji. Na nikaambia wazee, sasa saa zile wameleta uji, patia hao nafasi tu kidogo. Pia wawaeleze huko nyumbani kama watoto ni wazima ama sio wazima, si ndio? Usisha hawa wamama katika uongozi. Because we have seen that women deliver on their assignments. Hapa jirani tu Tanzania, mnaona Rais Samia Suluhu anafanya kazi nzuri sana. And we have enough examples even in this country. Chief Justice Martha Koome anatoka wapi? Si ni wa Meru? Sasa huyu mama mnamsumbua kwa nini watu wa Meru? Ni wachache tu, si ndio? Kwa hivyo muendelee kusupport huyu mama akaweze kufanya kazi yake, because I'm sure tukiweka efforts zetu pamoja, the kind of gaps that we are seeing in teenage pregnancy, we shall be able to sort them out. Jambo la pili, gap ambayo tuko nayo, ambayo as a country we have committed that by 2027 we must end AIDS in children. Na mimi nimesema kila mama ni daktari kivyake. Ukiwa pale nyumbani, mama akiona mzee anakohoa, anamuuliza utakunywa maji moto na lemon ama na honey? Si hiyo ni matibabu? Sasa hawa wa mama, we must leverage on them kuhakikisha ya kwamba tuna manage mother to child transmission. Lazima tukuje pamoja tuhakikishe hawa mama wanapewa nafasi ya kuhudumia jamii zao. Na ndio kwa maana sisi kama serikali tumesema tutatumia hawa community health promoters. Hawa 3,700 wa Meru, kila mmoja wao ako na jamii nyumba zake 100 ambazo lazima atembee awahudumie. Na wakati hii hakuna mchezo. Gavana tumewapatia simu. From next week tunaanza kuangalia ile data ambayo tutapokea kutoka Meru. Mimi nikiwa kwa ofisi niko na dashboard. Nitakuwa naangalia hawa CHP wa Meru niliwapatia simu wanatumia ama hawatumii. So I'm confident with the program that His Excellency the President is leading ya universal health coverage, tutaweza kuhakikisha ya kwamba Wakenya wanapata huduma. Na kwa sababu najua kuna watu wengi sana wananisikiliza, kumekuwa na mjadala ya kuuliza hii social health authority yako tutalipa pesa ngapi? Hata juzi niliona mtu ameniweka kwenye gazeti cartoon ya kwamba ng'ombe maziwa imeisha na mimi na Humicha ndio naendelea kukamua kabisa. Na nikasema There are many people who criticize things for lack of knowledge. But when you educate them and they get to understand, they stop their criticism. So today I want to educate Kenyans. One thing for sure that we have agreed, and I know in our regulations we have put, is that the minimum payment is going to come down kutoka shilingi 500 hadi shilingi 300. Hiyo ni mzuri ama ni mbaya? Si ni nzuri? Na sasa nimesema Wakenya wajitokeze kwenye public participation. Watueleze hii 2.75 ni sawa ama si sawa. Kuna wale wanasema hapana, inafaa ikue another percent. Kujeni mtueleze. Kuna wale wanasema katika hii 2.75% weka a limit ya 5,000. Kujeni muambie wale wataalamu tuweke band ya shilingi ngapi. Lakini kama vile rais husema pale nyuma, mtu ambaye alikuwa anapata shilingi 10,000 alikuwa analipa 500 shillings. That is 4%. Mtu ambaye anapata mshahara kubwa, and the highest paid in this country is the president. Alafu mimi waziri na waziri wenzangu tuko hapo chini, alafu PSS hawa masio pia wanapata pesa. Na walikuwa tunalipa 1,700. Mtu ambaye anapata 1 million, hiyo 1,700 ni 0.017. Je, ni haki mtu wa shilingi 10,000 kulipa 4% na mtu wa milioni kulipa 0.01? Ni haki? Ni haki kweli? Si lazima tutengeneze? Kwa hivyo mnanipatia fursa ya kuendelea kutengeneza, kuhakikisha mtu analipa kulingana na kiwango cha mapato yake. I love you Meru. Nawapenda sana. Nyinyi ni watu wa kusema ukweli. So mimi nitarudishia rais report. Mwambie nimetembea huku. Watu wa Meru wamesema hii Social Health Authority iko sawa. Sisi tuendelee na ile kazi tunafanya. As I finish, nataka kuwaomba wote. The fight against HIV is not an individual person's fight. Ni sisi wote. Na ndio mnaona nimekuja na waziri mwenzangu. Na by the way pia nilikuja na waziri mwenzangu mwingine na amesema nilete salamu kwa sababu yeye ni mtu wa hapa. Mmepokea salamu? Waziri Ntuku nimemuuliza mbona hukuji kwa mkutano? Akasema hiyo mkutano imejaa wamama, mnaweza nifinyilia chini. But nitamrudishia salamu niseme wamama hatufinyili, tunapenda wanaume. Kwa sababu peke yetu hatuna raha ya kutosha. Lazima mkue hapo karibu. Angekaa karibu na mheshimiwa Kimtai, akae karibu na Olekina, akae karibu na mheshimiwa Pato na Brian pale, alafu tuendelee. But ameleta salamu zake, yuko humu. Sisi kama serikali tuko hapa. Mmesikia tuko na issue ya floods. Tumeambiwa kule Tigania kuna watu wamekuwa affected. So tuko hapa kama serikali pia kuhakikisha ya kwamba kesho tunashughulikia wale ambao wamekuwa affected na floods pale Tigania. Na pia mchana tutatembea tuende pia upande wa Isiolo tushughulikie wale ambao wamekuwa affected upande ule. Lakini nataka kuwaomba watu wa Meru. Wewe kama unavuka mto na unaona mto umejaa, hakuna haraka. Wewe ngojea. Hata mama kama ulikuwa umeenda sokoni, afadhali ulale upande huu, upigwe kesho yake na mzee kama uko hai, kuliko uingie kwa maji na ukufie kwa maji. Si namna hiyo? Na nataka kuomba wazee, wakati huu tuko kwa 16 days of activism against gender-based violence. Tafadhali, mama akichelewa jioni, muulize tu kwa upole alikuwa wapi, atakuelezea. Na ukiona mambo ni ngumu, tumia mtoto pia muongeleshe. Tuachane na maneno ya gender-based violence. Watu wa Meru, asanteni sana. Asante kwa kutukaribisha. Na mimi siondoki, niko humu tu mpaka kesho. Shida ni kwamba watu huwa wananiangalia, hata huyo Lekina saa zingine anipendi sana. But najua sio sura yangu ndio mbaya. Lakini Unajua Meru ningeendelea kukaa lakini mzee nyumbani pia ataumia. Lazima nihakikishe nimerudi nichunge watoto. Asanteni sana watu wa Meru. Mungu awabariki.
Thank you very much, Waziri. Tutaki kukurudisha chini. Kila wakati wa World AIDS Day tunakuwa na celebration, na leo tuko na vitu tatu tuna celebrate. Moja ni progress, na hii progress tumeiweka kwa kitabu tunaita World AIDS Day Progress Report, na nitaalika wenzangu Rose Wafula na Bashir wakuja hapa, waziri, PS, viongozi, chairperson, viongozi wa bunge na partners wale wako hapa, wale walikuwa wanaongea, watu join hapa tuweze kulaunch hiyo report. Alafu pia tuweze kukata cake to celebrate hii siku. Tunaweza keti wale wengine tuendelee na hii shughuli.
Thank you. We are doing well. We are doing well. Let's have a photo. And then we are going to launch our 2023 World AIDS Day report in the next few minutes. Kindly let us not leave until we have the final prayer. Thank you. This is a team of different entities. You have partners, we have government, we have community, we have religion. Thank you. Let's have that photo. Let's smile at the camera. And then from there, we'll be going to the lounge, kindly. So with profound respect and honor, I beseech all of us to come here at this big screen for the digital launch of the 2023 World AIDS Day report. Tafadhali tusimameni tu hapa. Waziri, PS, CEO, Road Masha. Tusimameni tu hapo. Her Excellency Governor, together with the CS, please kujeni tu hapa karibu. And now, ladies and gentlemen, I beseech all of us to be upstanding. We are having a countdown of 10 before we have the official launch. And I believe wale wengine kujeni upande huo nyuma hapa. We can see people on stage. Please, let's come on this other side. Now let's go together. 8, 7, 6, 5, 4, 3, 2, 1. Yeah! Rounds of applause. Rounds of applause. Rounds of applause. Thank you so much. Now let me have the CS, the governor, the PS, so our CEO, NSCC, up for a photo facing this side. Chairman, you can also follow the suit. Thank you. Let's have that photo kindly. Tusonge nyuma kidogo tafadhali. From here, we'll be welcoming our CEO, NSDCC, for a cake session. And then we'll be having a group photo with everyone. Please, let's have it. Watu tusonge nyuma kidogo for the media team. Kidogo tu. Allow me to request people to go back for the media team to do the coverage. We are doing this because of the media and the coverage. Okay, let's do this kindly. Okay. Haya, tuinue juu kidogo kitabu, tuinue juu kidogo sisi wote. Okay, thank you. Let's smile, let's smile, let's smile. Media is doing their job. Thank you so much. Asanteni, thank you. And now, with profound respect and honor, allow me to welcome Dr. Ruth Masha for the next session.
Thank you very much, Waziri. Today, it is communities leading. Communities wamesema serikali imeandika kitabu. Wakasema pia wanaandika yao. Kwa hivyo waziri, tuko na kitabu, na hii kitabu imeandikwa na networks, the network of people living with HIV, na wanasema this is their contribution to the country national HIV response. And we would like to invite you, and you're joined by Nelson Otuoma, Kanini, one of our champions. We have our young person, Joyce.
Joyce is here.
Remember Joyce?
Thank you.
Please come in that order. The rest of us are excusing kwa sababu community mkaya hapo karibu na PS na waziri na governor na waziri mwingine. Tafadhali waziri kuja karibu na.
Let's have the photo. The community and the CS. Thank you so much.
Yes.
We have books for all of us. Please, let's have the books. Thank you, Bosire. Thank you.
Kuna kitu ya kufinya? Kuna kitu ya kufinya kwa hii? Tunaweza inua kitabu tupigwe picha.
Tuinue juu. Spirals kama spirals zikiwezekana, we'll appreciate from the technical team. Haya, tuinue juu tafadhali. Can we have spirals, please? Haya, tuinue juu vitabu tuonekane vizuri. There we go. Thank you. One more. Thank you, thank you, thank you. Thank you so much.
Hello, just a minute. Thank you very much, Waziri, and thank you for the language, Be Waziri and Be Governor. The owners of this report have come, and the owners of this report are here. The commitment from us is that we are going to work with you and government structures to make sure that we end AIDS among everybody else, but priority, children, by 2027. The other document we are launching is a strategic plan by elderly living with HIV. And because they have a problem, we thank you very much for inviting the CS labor where there is social protection. So as you talk about people with disability, children, orphans, widows, think about people living with HIV who are aging with HIV. They also need social support. And thank you for inviting a senator, because that is where the budget resides. So thank you very much. And they wanted to request to have a photo with the dignitaries, the owners of this book. Then we can just leave. So, Jogona, Anesia, kuja karibu na waziri pande hii.
Karibuni Patricia. Asanteni sana.
Yeah.
Tusonge tafadhali kidogo for. Thank you.
So as we do this, we want to appreciate UNAIDS office in Kenya because we produced this book. Thank you very much.
Okay, thank you. After this, we'll be going straight to the cake session. Before we allow our chief guest and the rest of the team to sit. Thank you. Let's have that one, and then we go straight to the cake session. Okay, okay. Now, thank you. Let's have a photo. Let's have a photo.